Alliance Live. I'm Ashley Mitchell from Communicare247, and today I'm joined by our very own CEO Tom Morton, and we're both going to share a little bit more detail around Project Liberty. Over to you, Tom.
Hello everyone, and thank you very much for joining us today. Project Liberty was a project that started in 2018. It was funded by a joint SBRI challenge with Glasgow City Health and Social Care Partnership. And today I'm delighted to share the results of that with you.
As Tom said, we're delighted to be with you all today to talk a little bit more in depth about Project Liberty. But first things first, a little bit more detail about us, about who Communicare247 actually are. Communicare247 are very much at the forefront of a transitioning health and social care system. Communicare247 delivers integrated health and care services built by the community and equally for the community. In terms of Project Liberty, in 2018, Communicare247 secured Phase 1 funding from the Glasgow SBRI Technology for Managing Risk at Management at Home competition to develop a proof of concept for a new digital telecare solution that allows citizens to stay independent at home for longer, whilst providing carers and health and social care staff the tools to manage risks and health at home. This was called Project Liberty. Project Liberty adds functionality to Archangel, an existing award-winning police-preferred and resilient digital platform, to adopt new and modular sensor technologies and data analytics capabilities, and upgrade existing risk profiling tools, and last but by no means least, improve asset management and location technologies to better manage risks in the home and equally the urban environments. Liberty really is our Internet of Things digital home care solution. Liberty provides citizen choice through modular sensors and monitoring technologies used within the home to demonstrate flexibility and adaptability to changing care needs. The sensors include smoke, fire and carbon monoxide monitoring, temperature and humidity monitoring, room activity monitoring, visitor logging and door monitoring, medication, food and drink reminders, and assistance alerts for family or any staff within the alarm receiving centre. And based on some of the feedback for our previous engagement, Project Liberty Phase 1 Proof of Concept allows for Archangel to be enhanced with new features to help better manage risk and care at home and within the community. Some of the new features included a fully featured dashboard, enhanced profile management, enhanced location management tools, and more powerful insights based on the data analytics within the Archangel platform. As part of Phase 1, Communicare247 worked alongside the Alliance, who have co-design experience and user research capability, to engage with people with complex care needs, their carers, care providers, and health and social care staff to collect their feedback on how the Liberty solution could best support their needs. As part of this engagement process, the Alliance held a series of workshop events with 35 participants. Each workshop was attended by a mix of citizens and equally health and social care staff, which included telecare users 65 plus with complex care needs, including mobility issues, social workers, social care and service managers, unpaid family carers with family members living with dementia and frailty. And as a result, from the 35 participants across 5 workshops, Communicare247 was able to retrieve useful feedback, which was used to make design improvements to the Liberty system. Some of the feedback included simplicity. The products and services used must be simple to install and use. They should not require a high digital skill set. Smart speakers and voice assistants should also be considered. Equal. This allows people with sensory and other impairments to use it effectively on an equal basis to those without such impairments. And in terms of mobility, the services need to enable mobility so that it works outside of the home, and equally flexibility for changing care needs. In terms of the interface, this adds a user interface for carers with summarised information, including lifestyle monitoring and alerts. Interoperability. IS integrated, including interoperability with personally bought devices. Reliable. Improves reliability, including more accurate alerting of relevant responders to alarms. And last but not least, valuable insights to help wider teams to better manage alerts, communication, and effectively support individuals using real-time and predictive data. And now I'm going to hand over to Tom, who's going to share a bit more information on phase 2.
Hi, thank you, Ashley, for that introduction. And what I'm going to do now is just talk about what happened after the feedback phase. So Communicare was then delivering a successful proof of concept for Glasgow Health and Social Care Partnership. And then what happened subsequently is in December 2020, Glasgow awarded us additional funding to support phase 2 of the project. So Liberty phase 2 would then enable a scale deployment, and that would see Liberty actually being deployed and tested into citizens' homes, which is really where we are today. The feedback that we received from citizens and stakeholders that were involved in that phase 1 meant that the final design would better meet the needs of citizens and care providers in phase 2. Liberty was also going to resolve all the challenges associated, well, not all the challenges, but some of the challenges associated with the analog to digital telephony switchover, which will see some of the telecare systems become obsolete. And by introducing commercial sensor technologies and consumer products, we are hoping to deliver an alternative care management system for the home care sector. Key partnerships that we've identified to work with during this process is obviously Glasgow City Health and Social Care Partnership themselves, Alzheimer's Scotland, who are going to bring case study for individuals with dementia and Alzheimer's, and for Leonard Cheshire, who are involved in supported living accommodation for those with learning disabilities. And once again, we'll work with the Alliance to engage those end user groups. So as part of phase 2, Archangelº is going to receive a significant range of scale upgrades, which was going to allow for much more meaningful use of the system. And you'll see here from the image that what this means is that we're going to provide a whole, first of all, an integration of the urban environment with the home environment. So you can see this, the image of the fellow walking the dog using some mobile devices. And inside the house, say the increased sensor activity plus the use of Alexa. All the data then is being fed up into the cloud system, and that data set could be environmental data, which is about temperature of the rooms, humidity, etc., activity data, movement around rooms, movement around the community, but also health data, your blood pressure monitoring, your temperature, body temperature, and so on. Plus location data, so we can understand whether you're actually engaging in the community or being at home most of the time of the day. So these are the kind of areas that, and of course, fundamentally the ability to call for assistance using SOS and monitoring your safety in terms of falls, etc. That information is then put up to Archangelº, and Archangelº then shares that information with a whole bunch of stakeholders. And those stakeholders could be anywhere from the alarm receiving centre through to family members, emergency response providers, the care providers themselves who want to do assessments, and believe it or not, people like utility providers or indeed the fire and rescue people. So, for example, if you have a flood in your local area, it's interesting if you're going to cut off the water, that you need to know who's vulnerable in your community in that area before you go switching the water off, or who needs water, to be provided to them safely. So we're providing fully personalized dashboards, and that allows the stakeholders themselves, family members, etc., to actually log in. And when they log in to the cloud, they're going to see data that is meaningful to them. So they're going to get presented with the information that they need. In terms of the equipment and interoperability, one of the feedback aspects was that they needed to be resilient and reliable. So we've searched the market for available technologies, and we've brought together some fantastic pieces of kit which is compatible with existing infrastructures within the communities that we're currently working. So specifically, we have a whole range of technology in here. There's no point boring you with it, but effectively, it becomes a resilient and reliable system. There's a wide choice of equipment and sensors, which means that you can make this modular and scalable. And of course, we've got a whole integration piece with not only the sensors within the home, but also things like the Alexa, which brings consumer products and consumer services to you, and also mobile devices and mobile applications. So you can actually have a choice of mobile devices for your community work and community when you're out walking the community and engaging and socially engaging. But also in the home. So this is a system that monitors you at home and also while you're out walking and about, either walking the dog or going to meet friends and family. So specifically, some of the technology we're looking at, we've delivered an app basically called Freedom App and a device called the Freedom Device. So both of these devices provide GPS information, but they're there to support you with assistance requests with a built-in SOS function, but also tracking. So we know where you are in the event that you do require assistance. And this is particularly important when you're out and about in the community, because we don't know where you are unless we can find out through the device or through the app. We've also got inbuilt here fall detection. The ability to give feedback via the app. So we can check your mood, for example, here. We can check whether you're feeling there's a good day for you, whether you're feeling a bad day. You've also got the ability to call for assistance. So you can actually call a friend in terms of, if you want to chat or if you're feeling a bit vulnerable, you can do that. But also, if you've got an issue you want to discuss, or perhaps there's some sort of plumbing issue or a kind of issue with the heating system, you can request a call back. And basically, you just send a message to say, it's not urgent, but give me a call, and someone will call you back. Moving on to the Alexa, this is probably the most exciting part of the integration work that we've been doing. Obviously, the Alexa brings a whole pile of different things to you from Amazon. You've got a whole bunch of Amazon services. But what we try to do here is include accessibility. So for those with physical or sensory impairments, the Alexa provides the ability to use voice controls to instruct things to happen. So if you wanted to call for assistance, you would simply say call for help. And also Alexa allows us to send you messages to remind you about, for example, take a pill, you've got a meeting coming up, or to acknowledge the fact that you've requested a call back, or that you've checked in the morning to make sure you're up and about. So for example, when you wake up in the morning, there's no reason why the sensor couldn't tell us that you're up and about in the bedroom and that you're active, and therefore we don't have to worry about you too much. We don't have to interfere. We don't have to phone you or anything. Just leave you to it. But we'll acknowledge the fact that you're up and about by sending you a message to Alexa to say, "Good to know you're up and about." So these are the kind of things. But also Alexa allows you to have voice chats and video chats, so you can call someone. And depending on the type of Alexa you've got, we're showing you the Alexa show here, but depending on the type of Alexa that you have, you can just simply make a phone call to someone, maybe your family member, or it could be used by us from the alarm receiving center perspective or the responder perspective to actually check in with you and see that you're okay. We'll phone you and ask you face to face. So lots of options with video and with text-based messaging from the Alexa, which again is going to make it much more accessible as a service. The idea here is to allow you to decide what how you want the system to work for you. So we've built in quite a lot of options here. The first one is the interoperability gateway. And what that means is that you can actually add devices that you want to use to the system. So, you know, we can give you some basic information, some basic devices, and we think, right, okay, here's our kind of standard service level that you require. But the interoperability gateway allows you to add your own phones or your own equipment, your own Alexa units, etc. So that's what the interoperability gateway does, and you can just build those into your system. What that means is that we can gather data from more than just the devices we're offering you in the initial launch. So you can create new requirements by adding new devices that are more specific and more customized to you. So by using that data, though, we can then build that into what we call the rules module. What the rules module does is it tries to make sense of the data that's gathered from the devices that are connected via the interoperability gateway. So the rules module creates if-then rules. So if a sensor is active and another sensor says, you know, for example, if I give an example, sorry, it's badly worded, but if I give you an example, so if the heat sensor says that the temperature in the room is less than 18 degrees, then we can send a message to the Alexa and say, turn your heating up. In a future environment, we might be able to switch it up automatically by going through something like the British gas system, you know, and we can actually create a temperature control for your boiler. So these are all future aspects, but that's what the rules module is able to do. So you can create something very simple, such as if the door's been left open, then alert Alexa and ask someone to close the door. But you can make it more complex by saying, well, if the door's open and it's 2 o'clock in the morning and there's no activity in the home, then alert someone. And that alert could then go to a responder. So there's lots of ways we can use the rules module. When we send an alarm out, though, we need the ability to manage that alarm. So who's going to manage your alarm? Does it have to be an alarm receiving center? Well, no. It can actually be a responder. So what we've built is a Care247 module, which allows a soft phone alarm center to be delivered to a smartphone or indeed through a PC. So someone at home will receive a message to say that there's an alarm, and then you can use the app or you can use the PC to check in on someone and make sure they're okay. And then we have finally what's called an API module. And what that does is it allows us to interface with external systems and external processes, for example, through the NHS systems. But what does it mean to you as a user? What can we give you as a service? So that's all very well talking about the back end stuff. This is the real front end. What do we do with you as users? So first of all, we want to know that you're okay, and we want to know that you're okay on a daily basis. So what can we do? We can either call you and check that you're okay. We can send you messages and say that you're and check if you're okay, or we could get you to say that you're okay by simply pressing a button. That's the I'm okay function. So I'm okay can be a physical action where you press a button to say that you're okay, or it can also be an automatic sensor-based system. So basically when you're up and about in the bedroom, for example, in the morning, and then you head up downstairs and you go into the kitchen and you make yourself a cup of tea, then we know you're okay because you're up and about. So that's the I'm okay. And what that does is it reassures not just the family members that you're okay, but it gets them off your back. You can just quite happily get on with your day. Comfort messages are customizable and personalized messages, which are really there to provide additional support when it's required. So, for example, it could be a little prompt to say that you've got a pill to take, but it could also be a prompt to say that if you need learning difficulties, for example, or you need some sort of mental health support, then we can prompt you on a regular basis to remind you that, you know, you're a fabulous person, or remind you that you need to do a specific task by a specific time in order to, you know, get your day off to a good start and get your routine started. So that's what comfort message does. The callback I mentioned earlier, the callback is basically a non-urgent request where you need someone to call you back, but it's not urgent. So just send a message, then you know someone's going to call you back. The friend in need service is basically from an alarm center perspective and from a responder perspective. And what that does is it allows you as a citizen to call someone. It's non-emergency, but you're feeling a bit off. You want to have a chat with someone, whatever it is. You're lost, you're confused. Whenever you feel vulnerable, you just press the friend in need button, and then basically you're speaking directly to someone, but it's not an emergency. Welfare checks are backups. What they're doing is they're looking for the I'm okay function in the morning. Are you up and about? And if you're not, then we create a welfare check. Comfort messages. Have you actually completed the task? And if you haven't, then it creates a welfare check. What the welfare check does is it reminds you that you need to do something and complete the task. So you need to confirm you're okay, or you need to confirm that you've completed and eaten, you've taken your food, or you've taken your medication. If you don't respond to the welfare checks and confirm these things, then we have what's called a welfare alarm. And the welfare alarm is basically an alarm going to a first responder, which could be your next of kin, your family member, or the alarm receiving center. And then someone else is going to then phone you and check that you're okay. That's the purpose of it. But what it does is it allows you every opportunity to sort yourself out before you disturb an alarm center or get someone else phoning you. And then fundamentally, if you're in an emergency situation and you need assistance, then you've got the SOS capability. And SOS is basically built into the Alexa service. It's built into the small panic buttons that we will provide you with. And it's also built into the apps and the devices. So every single product and service that you've got available to you has the function to call for help. The purpose behind all this is to try and help with assessments and reablement. We're trying to minimize the contact. The feedback we had was that you like seeing the carers, but sometimes you get too much of that. So there's too many people coming to see you. It's a balancing act between the need for the care provider to know that you're okay and living well, and your desire to make sure that you're independence. So effectively, what we're trying to do is give remote access to those assessments and reablement. What that means is that the providers can actually see that you're living well. They can see that you're interacting in the kind of global aspect of the community, and it means that they can actually be reassured that you're living well and you don't need any further intervention than you've currently got. Now, obviously, you have the choice to ask for more, but at least the commissioners are able to see how well you're living, that you're feeding yourself, that you're up and about in the morning, you're active when you're supposed to be active, and also look for deteriorating elements of that. But that's what the assessments and reablement's for. It also means that your family can view how well you're living, and again, your family then are reassured. Care pathways are about different types of care delivery methods. So if you've got learning disabilities, then that's one care pathway. If you've got a heart condition, that's another care pathway. If you've got diabetes, that's another care pathway. So basically what we're doing with care pathways is allowing professionals to view specific data sets and manipulate data sets to provide reports on how they want to view your progression in your care pathway. And again, that's all done by web services and web remotely done. Predictive care is where we start looking for trends. So, for example, if you're not taking your pills on time, is that because of an early sign of deterioration in your cognitive ability, or is it just obstinance? No, seriously. When you are in predictive care, what we're trying to do is look for trends that indicate that you may have an illness or you may not be coping as well as you could do, which then results in either additional support or indeed further visits from care providers. And then increased efficiency is about the challenge for resources that are currently available, and particularly now in the light of COVID-19. What we have at the moment is lots and lots of silo systems of data, and that data is not shared in any way. So you've got a book in the house where all your care notes are kept, for example. That information is kept on that book. It's not shared with anyone. So by increasing the access to data from your ability to live well, your ability to be socially engaged and out and about, then the care pathway is being managed effectively. What that means is they don't have to have as much contact with you unless you want it. So they can start to look at redirecting some of the resources that they've got to people that need that extra piece of care and leave you alone because you're fine and you're living well. So there's a balancing in that. But what that increased efficiency means is that the budget for care delivery services stretches much further, and more people get to use the services and more people benefit. And you get more customizable systems and more customizable services for you. Within the context of the feedback, everybody was asking for more access and better intuitive systems that they can log in. So what we're doing here is providing dashboards that allow individual users to provide access to information based on your login credentials. So if you're an alarm center operator, you get one type of login. If you're a next of kin, you get another type of login dashboard. And all of that gives you 24-hour activity monitoring with valuable insights to what's happening in the day. And you can see here on the screen, we've got alarm interface at the top, we've got some activity information in the middle, and then we've got some statistical analysis in the bottom here. So these dashboards can be created to suit your requirement when you log in. Profile management is also vital. We need to know who you are, and so therefore we need to know much about you as we possibly can, and that would include if you've got a vehicle, what kind of vehicle is it? Where did you last park it, for example? User health profiles. What is your current position in terms of health? What's your medication? Is there anything we need to tell a responder, for example? That would be contained in your health profile. Then we know who your responders are. So we want to know about who you want to be notified whenever there's an event or an alarm or etc. And so that feeds into, for example, the rules module. So the rules module would choose which responders get to know when you've created an alarm. What devices do you actually have? What are the reports that you need to create in terms of that alarm? So this is where you would build your rules for you as an individual. What are your settings? When are you supposed to be up and about? When does your clock period start in terms of the I'm okay function? And by what time? Because what you don't want to do is have an I'm okay interruption at 8 o'clock in the morning if your day doesn't start till 9. So we can set that up on a user basis. And then welfare checks will be run based on whether you're on your mobile device or whether you're at home. And then the rest of it is really about who gets access to your data. So the portal and admin allows you to control who has access to your data. So does the GP get to see it? Does the occupational therapist get to see it? Does your next of kin get to see it? What data are you sharing with these people and why? In terms of the devices, this is about really being able to control which devices are allocated to which users, and this allows you to use bulk uploads. So you can accommodate multiple devices and allocate them to multiple users, and you can and just swap them around whenever you need them. We can also view the information relating to the devices themselves. So even though there's a sensor in the home, we can tell, for example, if you look at the central one there, temperature and humidity, we can tell that the room is at 19.4 degrees, that the humidity level is 63%, and that the battery in the unit is 2.93 volts, which is okay. So we can start to tell whether the devices are functioning. We can also tell what's happening in your room and check your environment out, so we know that you're living. So if you've got COPD, for example, at what point does the humidity become a problem for your health? And these are the kind of insights that can start to be delivered. Activity data is about your physical movement, and we can also see whether you're in a room or whether you're out and about. That tells us whether you're social included or whether you're actually physically in the house and isolating. Heartbeat data is literally that. We can tell heartbeat data of you as an individual in terms of heart rate monitoring, but we can also tell the heartbeat, and we use this term to determine whether or not a device is connected. So we know whether your devices are functioning, and we know whether you are functioning too. Inside the rules, these are where you set your conditions. So this is just a screenshot of some of the basic rules package. So you can create a new rule and create that example I gave you earlier on, which is the door contact being open. If it's open greater than 1 hour, then on a weekday between 7 o'clock and 8 o'clock, alarm. This is about some of the location information, and what you can see in the platform is the ability to view live location information. So we know where you are at all times, and if something is, if you create an alarm, for example, then we know exactly how to deal with that. We can find the nearest responders to you, and we can dispatch them by sending them a message. The message would contain your information about who you are, where you are, and your profile information would be attached to that. You can also do multiple searches and find out where the individuals have been for a particular between 2 dates, and you can also see the routes that were taken. So you can actually get a fair idea of if where people have been and where they're going. We also provide geofencing, and this is particularly relevant for Alzheimer's and for risky areas. So we've presented in this instance a hazard, which is a park pond. So the park is on the left and the green. The pond, unfortunately, is behind the image. But by creating an image around the park and putting a geofence around the park, we can alert when someone enters the park, which might present a risk to someone with Alzheimer's, for example, because there's a pond in there with no barriers. And the geofence can be sent to next of kin. It can be sent to the alarm receiving center, but ultimately with the aim of trying to present some sort of intervention. We could even send the alert to you as an individual user, and then allow you to make that decision as to whether or not that's still a hazard for you. Alarm receiving centers also receive a queuing system. So we can see multiple alarms being handled here in this instance, and they're just physically shown up as a queue, the type of device that's actually creating the alarm, and the type of alarm that's been created. So in the instance here, we've got on the right-hand side, we've got several SOS alarms and 2 geofence alarms, and we can see that the SOS alarms have come from a couple of pendant devices, panic buttons, but also from a body-worn, wrist-worn device with an SOS button. And the geofence alarm has been created by the app. So on the app, we've obviously gone into the park, for example, and then we've created a geofence alarm. When you open up the alarm, you get this pretty much the same interface. So you can begin to see not only the alarm itself, but also where your nearest responders are. So again, that's just repeating that. But fundamentally, what's also in here is the ability to connect the call. So you can connect by telephone call between the alarm operator, i.e. the responder, and the citizen themselves. So you can actually have a conversation with them. And if we show that in the next screen, within that context of the conversation, you can see here, for example, 2 brothers. So the one brother's created the alarm and the other brother's a responder. So we've now connected Scott with David, and they're having a conversation. So they can actually now have a conversation regarding the situation they're in. If David then decides that Scott needs emergency assistance, he can actually call the emergency assistance from that app. And you can add another responder, for example, brothers, another sibling, and then have a conversation about who's going to go and help Scott. So David can call, for example, Joyce, and then Joyce can agree to go and see Scott. what we're really about here is trying to deliver lots of information and reports. So we've created some alarm type data, which shows you, kind of examples of what types of alarms are being created by individuals within their own home. And that allows you then to see, what type of assistance you might consider for the future. Because if you're starting to see more and more alarms created, then clearly mum or dad needs some assistance at some point. You can also look at, for example, the alarms by the type of alarm being used, and also the outcomes. So were they genuine alarms that you required to take intervention on, or were they false alarms, i.e. positive but false, i.e. there was no requirement for you to turn up. More reports, more searching capability. There is no end to the amount of reports that we can create, and depending on your requirement, we're going to be able to generate reports based on customized needs. So really, in conclusion, what we've done is we've taken all the feedback from the stakeholders and carers in the phase 1 example, and then we've built a proof of concept based on that feedback. That feedback has allowed us to go to secure the phase 2 funding, and we're now going to continue the development of that into a scalable production system. And we believe that this is going to address many aspects of the global care system challenges. We're really pleased that Glasgow's put their faith and confidence in us, and we're really hopeful that you'll help us by participating in some of these trials. And we're really keen that Project Liberty is going to deliver that advanced care at home system that you've asked for. And we look forward to seeing citizens living safely, longer and independently in their communities. Thank you.